topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, San Antonio. Welcome to another Ask the Experts, where for the last 16 years, we have brought you the top experts in the field of legal, health, financial, and home improvement. Our expert doesn't know we're probably going to keep her on a little bit longer today. This is like, we've had so many problems with this show. You know, we do live shows. Most people do a pre-recorded show. Not us. We like them live. Folks, let me tell you something. I had so much trouble when I applied for Medicare. And we start getting letters from the San Antonio area saying, why aren't you doing a show on Medicare? And I got to tell you, this show is so important. We found the top Medicare agent. It's called Medicare Gals, the signature team. Let me welcome to our show, Susan Shimp. We did it, Susan.
Yay, finally.
You sound wonderful and you look great. And if you've got some time, I'm hoping to keep you on a little longer today because I just want to kind of make it up to you.
Oh, well, thanks. Yeah.
So, Susan, tell people, and Susan, I love your background. Tell people about your background in Medicare Gals, the signature team.
So the Medicare Gals, the signature team was founded in 2015. And we have been a local Medicare resource for people in the San Antonio area and surrounding communities, New Braunfels. We are located in New Braunfels, Texas. And we are just a resource to help people with problems with Medicare, because everyone has a problem with Medicare. You get a bill, you have a doctor that's not in the network, you're trying to find a dentist, you're trying to find something and you don't know where to turn. That's where we are. That's what we do. We help you enroll into Medicare. We give you all the resources on how to avoid penalties and to guide you in the right direction, because there's so many different insurance companies and so many things that are thrown at you when you turn 65 and you're like, what is right? What is wrong? And we're just here to help kind of weed through all that for you.
I wish I'd have known you back when I went into the Medicare, because I tell you, I had a horrible agent. I didn't know at the time. You know, Susan, there's so many, we take for granted that everybody knows about Medicare. And I got to tell you, I thought, God, I'm so stupid. I didn't know. I actually missed out. It cost me a lot of money.
Yeah.
I found out now through the show, there's so many people who don't understand about enrolling in Medicare.
No, and that's the thing, is like they leave you to fend for yourself. They don't give you any kind of instruction or anything like that. You go to Social Security and they don't give you any advice. They just are there to answer certain questions, but they're not licensed. So, you know, that's where we come in. We help you avoid those penalties. If you're still working, do you need to enroll in Medicare? That's a lot of people, you know, I'm like, I have to enroll in Medicare. I'm like, no, if you're still working, you don't have to. And I explain why. So there's all these different nuances with Medicare. Medicare is the most complicated healthcare system in America. It is, by far. And, you know, to let you fend for yourself, it's so it's a lot of work. There's so many different avenues to go through, and we just want to make it easy for you. We want to make it so that it's so simple. You walk out of our office or you get off the phone with us and you're like, "Oh my gosh, I get it. I understand it. They walked me through it. I understand. I'm educated now about Medicare." And every year we are always with you. We are by your side. You can always call us if you have any questions. So, we're your patient advocate for life.
I got to tell you, because I've been through this, Susan. So this is why I'm so glad that we can offer a show like this. It's so important who your agent is. You guys do so much legwork for your clients.
We do. We do a lot for our clients. We just don't sign them up and then let them go and fend for themselves. We are there always. We look up your doctors. We look up your prescriptions. We help you find dentists. Where do you go get eyeglasses? What hospitals are in the
Yes.
network? So there's always these different little things that you might think you might know, but then you call the doctor's office and they're like, no, we don't take that plan. So it's like, who do you go to? We do. Go to us. That's what we do. We know all the doctors, all the networks, what everybody takes, how to get the free stuff, how to navigate your plan, and we do a lot for them because you get a bill, you get a letter in the mail, and you're reading through it and you don't understand it because it's all insurance government jargon, right? So they call us and they're like, well, what does this mean? And so we explain it to them, and they're like, oh, okay, that doesn't apply to me, or yeah, that does apply to me. So we're not only there to just help you with your enrollment, but we're there anything along the way, whether it be a letter you get or, where do I go for this kind of treatment? We're always there for you.
You know who I feel sorry for? I feel sorry for the people that uh, maybe don't read all their mail, think it's maybe
Yes.
junk mail, and it turns out their provider is no longer in their market anymore. And they just think it's going to be renewed, not knowing. I know Humana's pulled out of a lot of markets.
Yes, so we just got some good or bad news from one of the insurance companies like 3 weeks ago in the middle of the annual enrollment season. And they are not in network with a lot of the doctors anymore. So over 1,000 doctors were pulled, primary care doctors were pulled from this network. So guess what we
Wow.
have to do? We have to go back to all of those clients that are on that insurance and make sure their doctors are still in network. It's a second legwork that we have to do to make sure that the doctors are in the network for that client. I just got a text message yesterday actually, and she's like, I heard so and so is not in the network anymore. I'm like, oh yes, you're one of them I did not reach out to. So she reached out to me, and so now I have to find her a new plan in
Right.
2 days. In 2 days.
Oh, gosh. Susan, what would you say is the number one question people have this year?
The number one question is, why is Medicare taking away so much stuff? Like, why are the insurance companies cutting benefits? Why are they increasing their copays? Now, this is more for the Medicare Advantage side, not
Hmm.
not so much more for the Medicare Supplement side, but on the Medicare Advantage side, that's where a lot of people are seeing the sticker shock. You're seeing the copays go up. You're seeing benefits get reduced, and it's all because of the Inflation Reduction Act. And that happened January 1st of
Ah,
this year. And so what that means is now the insurance companies are paying more towards the high cost prescriptions for you instead of putting the burden on you. So they're taking the brunt of paying for those high cost medications, keeping it as low as possible for you. And so with them having to put out more money for the prescription drugs, guess what? We suffer because now we have to pay higher copays, or we get cut benefits because they're trying to save, their money.
Yeah, I noticed that with my eyeglasses 2 years ago. I didn't have to pay anything. I didn't have a copay. I got my glasses, and first of all, I didn't realize how much prescription glasses are. But this year, I wanted to go in and get a new pair, and it was $135. I went, wait a minute, 2 years ago it was nothing. Now it's
Right.
I'm on the Advantage plan,
Right.
so that you know that. But I was shocked, and you're right, rates are gone up.
Yeah. I mean, everything is going up. Nothing ever goes down, unfortunately.
Yeah,
The Medicare premium's going up. So that's going up about $17 per month next year.
yes,
And it's $202.90. That's the standard Medicare premium from 185. And so, if you're on a supplement plan, those premiums are going up substantially. Prescription drug plan premiums are going up. On the Medicare Advantage side, you're losing benefits, increased cost on copays. So across the board, it's not a win-win for anybody, right? It's because you're not making as much money. You're getting a 2.8% cost of living increase on your Social
right.
Security. And that's not anything to, save. I mean, you gotta be able to live, and with the cost of groceries and medical bills and prescriptions and daily life, it's very hard for people.
Several years ago, I, with the same company, had like a $500 allowance for
Yeah.
over the counter,
Yeah.
which was amazing. I mean, you get a lot of stuff for $500. They don't have it this year.
No,
Same
they
exact company.
Yeah, they have to take a lot of the companies did that, and they had to take that away because that's money that they don't really need to spend. They were just doing that as an enticement to get you to enroll, but now they can't afford that. Or so they say they can't afford it, right? Because all
Yes,
these insurance companies make plenty of money. But they're
yes.
trying to save the bottom line.
I got to tell you, this is kind of off the track. And then I got so many questions for you. Um, we had all kind of technical problems on your show on Wednesday, and to show you, no, it's okay. But to show you how important this topic is, we're on like 70 different platforms, iHeart, YouTube, Facebook. I mean, we're on so many. But I looked at our YouTube numbers for your show, and they were like over 500. And I was like, that's a lot, especially with the technical problems we had. And then I'm already looking at the numbers now on YouTube already. And wow, this is a very important topic. And Susan, we see all these national commercials, and I got to say it this way, a lot of them make these false claims or claims that
Yes.
don't, don't even target you because you're not even in the right market.
Yeah.
You need to realize, because some of these promises they're making are like too good to be true.
Yes, that's true. So what these national advertisements are is a way to get you to call in, and they
Yes.
are, promising everything, but then they give you nothing. So if you don't have low income, if you're not qualified for Medicaid, for example, or if you don't have certain chronic conditions like especially diabetes, congestive heart failure, or cardiovascular disease, you don't qualify for most of that stuff.
Wow.
So, you know, the big thing is get free groceries, get the gas card, get all this stuff. And they're like, ooh,
Yes.
everybody wants free, free, free. But then when
Right.
you call in, they're like, oh, well, sorry, you don't qualify because you don't have a chronic condition, or you don't have low income, or you may not live in the zip code that these plans are being offered in, right? And so then they're like, we don't qualify for that, but let me tell you what else you qualify for. And then they try to change your plan, and they don't even look up your doctors. They don't look up your medications. They just sell you a plan blindly. And then the next thing you know, you're switched. And then you go to the doctor and the doctor's like, we don't take that plan. So
Exactly.
it is a huge, huge complaint to Medicare every single year. And a lot of these call centers have gotten fined. One insurance company, Humana actually, has told Go Health, which is a call center, to cease and desist. They are no longer allowed to call and enroll people through Go Health on Humana because of too many complaints.
Wow.
So if
That
more
is,
insurance companies can actually do the same and follow up and, make sure that they don't do this anymore to people, then, there'd be less phone calls.
I'm telling people, don't call the company, call an agent like Susan. I got to tell you, I called Humana because I was curious on what my new benefits were going to be.
Mhm.
I just was just out of curiosity. And they said, well, you're not going to be having this anymore or this anymore. And I just wanted to see, since with the show and everything, I called back 4 days later and I got a completely different answer. This is
Yes.
why it's so important with, having someone like Susan Shimp's company to just handle this for you. Because I'm telling you, it is, you can get yourself so much in trouble. And, you deal with older, a more mature audience, and sometimes they don't understand everything that's going on.
Yeah.
And that's why I just appreciate you as an agent. Um, would you explain? I'm getting people want to know. God, I've got 3 texts about the Advantage plan versus regular Medicare.
So an Advantage plan is federally funded by Medicare. Okay, so what happens is Medicare pays the insurance companies behind the scenes and enables the insurance company like United Healthcare, Humana, Aetna, whoever, to facilitate all of your Medicare coverage. So basically, you have United Healthcare Medicare or Humana Medicare or Aetna Medicare. So it's kind of like an employer plan. It's an all-inclusive plan. You don't usually pay a monthly premium for it, but then you're going to pay copays as you use the service. So if you go to your doctor or a specialist, you pay a copay. If you go to the hospital, you pay a copay. But it also gives you additional benefits like dental, vision,
Mm.
hearing benefits. You get fitness benefits. So it gives you a free gym membership. And some of them give
Yes,
you over the counter money so that you can go buy your vitamins and supplements and stuff like that.
right.
The whole point of the Advantage plan is to keep you as healthy as possible. That's why they give you all these extra benefits to stay as healthy as possible. Now, with an Advantage plan, there is a network. So it's kind of like an employer plan where, if your employer plan was on Blue Cross Blue Shield, you'd have to stay in the Blue Cross Blue Shield network. So that's the difference. You have a network of doctors, and you have to make sure that the doctors are in the network. If you go on original Medicare side, you can do original Medicare with a supplement plan. So Medicare would be basically your primary, and that pays 80%. And your supplement plan through an insurance carrier, though, covers your 20%. But in
Yeah.
order for them to cover your 20%, you have to pay a monthly premium. And those
Mhm.
premiums are slightly higher right now. They're about $160 a month
Right.
and up, depending on your age. And there's certain rules with supplement plans. You may not qualify for them. So it depends on your age, and it also depends on your pre-existing conditions. So if you have certain pre-existing conditions, you may not qualify for a supplement plan if you're not already on one. Okay. Any doctor that accepts Medicare across the country, there's no network, just the Medicare network. You can go to any doctor on the Medicare supplement plan. So there's really no wrong way. There's two options: Medicare Original with the supplement or Medicare Advantage. It's just How do you want to pay? How do you want to get your coverage? Do you want the extra benefits? Do you want to be able to, go see your doctor? Do you want to be able to have all the preventative stuff that's all included in the Advantage plan? So there's no wrong way. It's just what's best for you. And that's what we do as with the signature team. I have two other agents with me. So the three of us, we just sit down, we talk to you, we look at your doctors, we look at your prescriptions, we talk about your health and find out what is the best option for you because there's no wrong way.
I'm glad you said that. I'm going to bring a situation I had. Again, I had a lazy agent my first go around. And what happened was there was a couple orthopedic or actually one orthopedic surgeon that had done some work on me. I really wanted to make sure he was in the group. And my agent, yes, he's in the group. Well, here's what happened. Yes, he was in the group, but our group had a separate group outside Humana's group. In other words, they had their own orthopedic guy. So I lost out because I had a lazy agent. You would have known that if you were working with me up front and we could have decided what to do.
Yes. And so there's so many different, and I'll tell you, IPAs. So these are doctors groups all throughout the country. And
Yes.
certain doctor groups, even though you may be in the Humana network or the United Healthcare network, these doctors have groups. And if your certain primary care doctor is not in the main group, you may not be able to go to that doctor, even though it's contracted with the insurance company.
Right.
So there's so many different like caveats with the Medicare. And for someone to do that on their own and go on to Medicare.gov and try to figure this out on their own and look up the doctors on their own, good luck.
Crazy.
It's hard for us.
That is crazy. You know, it's amazing, Susan. It's like my girlfriend who is on a PPO plan because she wants to be able to go to her doctors. And she always says to me, well, the HMO doctors, most of them aren't any good. I got to tell you, I've had to use an orthopedic surgeon twice, and I've had to use a nephrologist. Unbelievable. I mean, I'm on HMO.
Yeah.
Unbelievable. So when people complain about having to go to doctors that are in the group, hey, listen, they're great doctors. They're all in private practice.
Yeah. And most of the time, an HMO doctor is contracted with the PPO too. So it's the same doctor, different plans, but the same doctor. So most of the time they take both the HMO and the PPO. So, you're not going to have a better doctor because you're on the PPO. You're going to have the same doctor. So that's false information.
Yeah. So the questions that people wrote, especially after our show the other day, it's okay. Listen, you know what? I've seen some of the biggest networks that they do this and they freeze over and they lose. I mean, things happen. And I prefer doing a live show and because people can really see and feel your personality. I think people need to kind of yoke with their agent because this is so important what this agent, a person like yourself, is doing. But a lot of the questions that people had, and it shows that we just take for granted that people understand this, but they really don't. But the biggest question after your last show was, what is the difference between Medicare and Medicaid?
Yes, which I wish they would change the name because it's too close together. So Medicare is federal health insurance. It is the insurance that you get when you turn 65, and that is what you've paid into all these years, Medicare. Medicaid is state run. So that is each individual state has their own Medicaid, and that is based on income. So you have to qualify through the state that you're in to get on Medicaid. And then with Medicare and Medicaid, it's called the dual because you have both Medicare and Medicaid. If you qualify for Medicaid because of income, you can get both Medicare and Medicaid, and then everything's usually covered at 100% because income is low.
I'm going to ask you a personal question. Tell people what you did before this.
I was gonna say that when you were like, when it's a live broadcast. So I used to be in television.
Yes.
So
Yes.
I was a news producer and we did everything live. So, things can happen, satellites go down, the rain happens, something goes on. But yeah, so I understand. So I was in television for about 12 years. I was a news producer and then I was a sports producer and then got out of that. So now I'm doing Medicare and I love it. I absolutely
Well,
love
I
Medicare.
brought that up because communications is so important with what you do. And I had a couple texts of people who wrote me that said they really liked the way you communicate. You make it sound so much easier. And I think that is so important, especially with the age demographics you're working with.
Yeah, and that's the one thing I do pride myself on is I educate first. You have got to know what you're doing first before you can make any kind of decision. So educate, talk about the Medicare 101s. What's A? What's part B? What's part D? What's part C? What's part plan G? Like it's alphabet soup. We educate, make sure you know exactly what everything is, all the parts of Medicare before we even go into making a decision because this is a big decision. You don't want to rush it.
Yes.
You want to make sure that you're making the right decision for yourself, but know that we have your back. We are always there for you. We're just, always at your beck and call. Well, not 24 hours a day, but
Right. You can reach Susan at 2 a.m. every day of the week.
Yes.
Hey,
Call my
Susan,
number
what is
210-767-9876.
Susan, what has been your biggest surprise about the plan changes for 2025?
Well, my biggest surprise is that some of the plans have terminated. There are some big insurance companies like United Healthcare that
Yes.
has terminated a lot of their PPO plans across the country, which a lot of people are pretty upset about because they're basically pushing everyone to an HMO, which is fine. But, that's a lot of people picked a PPO so that they could have the flexibility of being able to go to doctors without referrals and stuff like that. So a lot of plans are terminating. There are some insurance companies that are pulling out of states. They are like, I don't want to deal with certain states anymore because of, the red tape or they're not profitable or stuff like that. So a lot of insurance companies have pulled out of states too. So the world of Medicare is changing. I've been doing this for 12 years, and this has been probably the most disruptive year going into 2026 than ever before.
Oh,
Yeah.
wow. That says a lot.
Yeah.
So there's a deadline. It's almost here.
It is Sunday, 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 December
Well,
7th.
tell people what happens if they don't enroll.
So December 7th is the deadline for people who are already on Medicare. Okay. If you're not already on Medicare, that deadline does not apply to you. Now, if you're already on Medicare and like a Medicare Advantage plan, for example, and you missed the deadline and you just got busy, like life happens, right? January through March, which is the first quarter of the year, you have a chance to make another change. So technically, you're not done as of December 7th. You have the first quarter, January through March, to make another change. So you do have that flexibility.
Yeah, it could let me tell you something. I know for a fact it can be very costly if you don't take care of this. Um, so if a person is first going into Medicare, they still have time.
That's correct. So there's no deadline for them except, depending on when their birthday is, they would have a deadline of 7
Right.
months, but not if they're not on Medicare yet.
And do you like the Advantage plan personally?
I do. I know how they work. And that's the key is a lot of people are very fearful of the Advantage plan because they don't know how they work. Um, my number one problem with it is the doctor's offices. Honestly, doctor's
Yeah.
offices, the front desk, they don't know what they take. They tell their patients wrong. They give them advice. And I'm like, well, here's the deal. I'm a licensed insurance agent. I'm not a licensed medical professional. So you're the medical professional. You give them medical advice. Let me, as the licensed insurance advisor, give them insurance advice. Don't give them insurance advice. So, what's best for the doctor financially may not be best for you financially. So it's just knowing how they work. Yes, Medicare Advantage works. It works well. It works the way it's supposed to. You just got to be in the right plan with the right agent to help back you.
We just got a great text in.
All
This is
right.
from Marie. She's in San Antonio.
Hi,
She
Marie.
said, I found your show by accident. This is amazing because I've been pushing my mother to get it registered. She calls it registered. And I've been listening to your show. I love your personality and your energy. I'm going to have my mother contact you. Could you explain to me, because I don't quite understand, there's A, B, C, and D. I don't understand the letters. Could you explain those?
And
Thank
all
you.
the
Nice
26
job.
other letters of the alphabet. Yes.
Yeah.
So, part A is the hospital. Okay. Part A is your hospital and all your inpatient care, hospice, rehab care, all that stuff. So, that is part A. Part B is your medical care. That's your doctors and all your outpatient care. Okay. So part A and B, that's standard Medicare, part A and part B. Okay. Medicare does not offer prescription drugs. So that's your part D, D for drugs. And that is where you have to go elsewhere to find a prescription drug plan through the insurance companies. Part D is your prescription drugs. Part C, I always say, is add A plus B plus D together equals C. So it's basically all of that rolled into one, and it's an Advantage plan. So you can
Right.
do A and B and D, or you can do A, B, D, C.
Okay. That's pretty easy. Um,
Kind of,
what's the
but
biggest
it's like,
mistake people? Yeah.
go ahead.
Go ahead.
Well, I'm just saying,
What's the
it's like,
biggest mistake people make when they don't review their drug list each year?
okay, so this is a big one because what's happening is the drug deductible, I should say, the drug deductible for Medicare has gone up to $615. So if you have a high cost medication and you go to the pharmacy and you didn't change your plan and your plan has that high deductible of $615, you have to pay that first before the insurance is going to even cover it at a lower cost. So if you're not checking your plan, and there are some plans out there this year that have that $615 drug deductible, you could get a sticker shock when you go to the pharmacy. So that's one thing we always say. The first thing we want to check is your prescriptions. That's the number one key. That's the biggest thing. The next would be your doctors.
Uh, Here's a new text. Okay. What's your advice for someone feeling overwhelmed by all the Medicare options out there?
So just call us. We'll ease your pain. We will ease your mind. We will make it so much easier for you. It is very complicated.
Oh my
And when
God,
you leave
yes.
our office, you will be like, oh my gosh, I understand this. Why can't this just be so black and white? And, that's where we can help uncomplicate things for you. So just call us. We're a free service. We do not charge. So, that's the good thing is we're there to be your fiduciary. We are your brokers. We don't work for the insurance companies. We do not work for Medicare. We are just your agent for life, and we will help you.
This is from Norman in Universal City. A friend of mine, actually, you are his agent,
Oh,
and I
yay.
saw you were coming on. I have a couple more years before I have to really get involved with Medicare. What if I have health insurance through work? Do I still enroll in Medicare?
Good question. So yes, technically, if you are working past the age of 65 and you have work insurance and your employer has more than 20 employees, you technically do not need to get on Medicare. So a lot of people are afraid that they're like, well, if I don't get on Medicare at 65, I'm going to get penalized. That's not
Right.
true. As long as you have employer coverage, as good as Medicare's, which is probably just as good, and you don't have to take Medicare technically until you actually physically retire or you lose your employer coverage.
Okay. What should a person do if their doctor or medication is no longer covered next year?
So if you go into the next year and your plan is not covering the doctors or prescriptions, like I had mentioned, you do have the January through March enrollment period, which you can make a change and find the right plan to fit your doctors and prescriptions. So like I said, you're not stuck. January through March, you can make a change. Yes, the deadline is Sunday, December 7th. But if you go into the new year and you find it's not working, you have that first quarter of the year to make a change. So
Antonio,
just make
what-
sure you call us and we can make that plan review for you.
Ben in San Antonio wants to know, Susan, love your show. I want to know, though, is there any benefits in 2025 that you are excited about?
In
That's a good question.
2026? In 2026,
I mean,
maybe?
he put 2025, but
Oh, okay.
I'm sure he
Well,
means
2026,
2026.
yes. So I'm excited about some of the benefits. Yes. So there are some plans that have really good dental benefits. There are some plans that have really good over the counter benefits. So usually on the over the counter benefits, and this is money that these insurance companies give you. Now, this is on the Medicare Advantage side that they give you to go buy your vitamins and your allergy medicine and your ibuprofen and your toothbrush band-aids, all that kind of stuff. So these plans usually give you a quarterly or monthly allowance, depending on the plan. Usually it's use it or lose it. If you don't use it that month and you don't use it that quarter, it's gone. You lost it. Well, some of these plans are now having them roll over. So it rolls over monthly or it rolls over quarterly. So you don't lose it. You just have to make sure you use it by the end of next year. So that's a nice benefit. It's, people forget to use it. People forget, they, that quarter went by so fast and they forgot to use that $50 or whatever. And so all of a sudden they lost it. Well, now it keeps accumulating.
I'll just be totally honest. I'm out here listening or watching the show right now. And by the way, Susan will be with us again next month. And tell me why I should sign up with your agency.
Well, one is we are local, and two, we have been in the business for 12 years. We are a staple in the community. A lot of the doctor's offices know us. A lot of the insurance companies know us. We are also very much on your side. So we are there for you. You can call us. You have our direct cell phone numbers. You don't have a transfer call system. You can always pop in and see us. We are just there all the time for you. One thing I pride myself in is I go above and beyond for my clients. Some agents will be like, okay, well, here's your plan and, figure it out yourself. No,
I have that
I'm
one.
like, you know what? If you have any questions, I have my clients call me on the way to a surgery and they'll say, how much do I owe? I'm like, well, did they not tell you that went to the hospital? They're like, no. And I said, okay, well, you know what? I know the plan that they have because I have really good memory when it comes to that. But when it comes to my phone and my keys, I can't find that. But when it comes to plans and what plan you're on, they'll call me and say, what's my copay for this surgery? And I'll say, $150. They're like, okay, great. I said, if they charge you more than $150, you let me know because I will call them. And I do. I've reached out to doctors' offices before, and I've reached out to clinics before. And I'm like, you cannot charge them more than what is contracted on these plans. So I fight for you. I'm a bulldog when it comes to insurance because you know what? I know how it works. And when these people are nickel and diming you, oh no, I do not stand for that.
We've been running your phone number and your website throughout the show, but we have so many people on iHeart, Spotify, and Facebook. Tell people how they can reach you.
So you can call us at 210-767-9876. We are also online at medicaregals-st.com. We also have an office in New Braunfels right down from Buc-ee's, so you can't miss us. It's a staple in the town, but we're called the Medicare Gals, the signature team, and we are available to you. But here's the other good thing is you don't have to live in New Braunfels. I live in San Antonio. I do home appointments. I do Zoom appointments. I do phone calls. So if you want to meet at your home, if you want to meet at Panera Bread, if you want to meet at my office, great. I'll come to you.
Can they do a Zoom with you?
Yes, absolutely. Zoom and or Google Meet. Yes.
And the last one, I got to get this in. I love your show. Do you cover Austin?
I do. I cover the whole state of Texas.
Nice.
And Austin is one of my big areas that I cover. Yes. Can definitely help you.
Well, Susan, hey, everything went right. It's going to be a great show. The numbers are amazing. We will see you next month. I want to wish you a Merry Christmas.
You as well.
And we will see you next year.
I know that's weird to say. Yes.
I know it is. I'm just glad we have you. Thanks, Susan.
Have all right. Bye.
Bye-bye.
You too.
Susan Shimp. She's with the Medicare Gals. Love the name, the signature team. And hey, that's going to do it for us today. We will be back with you next week with more Ask the Experts. Thanks, Juan, for all your great work.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.